so much, Kristine, for agreeing to come onto the podcast. I am excited to have you share your story today.
Well, thank you for having me. I'm excited as well.
Yeah, so tell us a bit about yourself and your family and maybe your work, because I think your work probably influenced your pregnancy too.
Yes, absolutely. So I am married, my husband, my daughter, now 15 months old, and I live in Charleston, South Carolina. And well, at time of birth, we had two German short hair pointers.
Okay.
Our old one has passed since, but
Aw,
I had to include him in the story. So
sure.
Charlie will be in there.
Yeah, yeah.
And so I'm very fortunate to be full-time stay-at-home mom. But then also partly work as a registered dietitian. So I
Okay.
kind of have a little side gig as
Right.
a dietitian, and I focus on women who are trying to conceive, are pregnant, currently pregnant, and then recently postpartum.
Okay.
So,
Awesome.
yeah, so definitely influenced, my pregnancy and kind of things
Yes.
that I did before, during, and after.
Yeah. Yeah.
But,
Yeah.
helpful for sure.
Yeah, for sure, for sure, for sure. So, in order to understand what happens during the birth, I think we always have to understand what happens during the pregnancy. So, let's start off with what was your pregnancy like? What was your prenatal care like?
Yeah. So starting with the baseline of pregnancy is hard. But relatively speaking, I wouldn't necessarily call my pregnancy easy,
Mm-hmm.
but I wouldn't say it was hard, if that
Okay.
makes sense.
Yeah.
I had like every symptom I think you
Okay.
could have. Like,
Okay.
you
All of
always,
them.
all of them, things that I didn't even know were a symptom beforehand.
Right. Right.
You always
Right.
think of fatigue and nausea and
Uh huh.
heartburn, that kind of thing. But like
Yeah.
carpal tunnel, I had no idea.
Mm-hmm.
And like
Yep. Yep.
itchiness. I
Mm-hmm.
was third trimester, I was super itchy.
Okay.
Like to the point where my husband was like, I think you need to like ask for labs or something
Right.
because it can be a sign. Is it like liver or
Uh huh.
gallbladder? I forget.
Cholestasis.
Okay.
Yeah. Mm-hmm.
So thankfully it was all fine. It was
Okay.
like no big issue.
Gotcha.
Just itchy. but
Okay.
a friend had told me about eczema cream, so that actually helped a lot.
Okay.
Because I was using lotions and oils beforehand,
Right.
but nothing was
It
helping.
just
But
wasn't cutting it.
yeah, but that helped. So yeah, I mean, all the symptoms, but everything was like manageable.
Okay.
I
Any
had
problem with
nausea.
nausea? Yeah, I was gonna say nausea,
Yeah,
vomiting.
I definitely had nausea up until like 16 weeks.
Okay.
But I really didn't vomit much,
Okay.
thankfully,
Yeah.
so that was good. The one scare we had was at
Mm-hmm.
16 weeks,
Mm-hmm.
at my OB appointment. The OB heard like a decline and then a pause in the heart rate.
Right.
And she heard it on the Doppler, and then she heard it on
Right.
the ultrasound. So she was
Right.
like, this may be nothing, but
Right.
like, let's refer you to MFM,
Okay.
get you checked out.
Right.
So that was at 16 weeks. And then they got me in like the early following week at 17. And the OB or the MFM doctor, he was like, if I didn't know what you were coming in for, I would have thought this was just an early anatomy scan. So like
Okay.
everything looked good.
Okay.
It was just kind of definitely anxiety
Just one of those.
provoking.
Sure. Absolutely.
But
Absolutely.
thankfully it was okay. I mean, he did want me to come back at 25 weeks when the heart was
Mm-hmm.
developed and do like a fetal echo.
Okay.
That turned out good. He was like,
Okay.
but there's like some of the measurements are like slightly small for gestational age. So let's have you come back one more time. So
Okay.
I went back at 29 weeks to MFM,
Okay.
but everything was good, and like they discharged me. So,
Okay. Okay.
just like a little extra
Yeah,
in
that's
the
still quite a
pregnancy.
few weeks though of a little bit of anxiety, or maybe a lot of bit of anxiety, worrying that is this going to be something that happens. I mean, that's like what 8-10 weeks of concern. So
Yeah. Yeah. I
yeah,
would say like at least after the first one, most of my anxieties were like, mitigated. Like that really
gotcha,
helped. But those first
gotcha.
like several days yeah,
Yeah,
it was rough.
yeah, yeah, yeah. And you said you
But
saw an OB. Did you see the same OB, or was it different OBs in a practice? How did it work for you?
yeah, so I think there were 7
Okay.
OBs in the practice. So I mostly like had already been seeing one for like gynecology care.
Hmm.
And I really liked her. So
Okay.
she was like my main, but
Okay.
then you had the option of seeing the other physicians if you wanted to,
Okay.
which I did. I wanted to like meet everyone beforehand because you never know who's going to deliver.
Sure.
So yeah, throughout my pregnancy, I saw, I think almost all of them,
Okay.
at least once.
Okay.
So
Okay.
yeah,
Okay.
so I got to
Okay.
meet everyone.
And how do you feel about the care you received?
Good. Yeah. I felt like, I would go in with questions for the most part. And so if I had questions, they would answer them. I liked the practice a lot, and I'd heard really good things previously about like
Okay.
friends that had delivered there too. So
Okay. Okay. Good.
yeah,
Good. So you overall great experience. It sounds like.
yeah.
Okay. All right. And what are some things that you wanted for your birth?
So I wanted an unmedicated birth.
Okay.
So I was going in, I was pretty set on unmedicated birth. Obviously,
Uh-huh.
you never know what's going to happen.
Sure.
I listened to a lot of podcasts
Uh-huh.
with medicated births, but I also
Uh-huh.
listened to a few stories that were like inductions or
Right.
C-sections, because you just never know.
Right.
The
Right.
one thing
What
I was,
podcast did you listen to?
well, obviously yours. So yours was so helpful, like just like all the medical information, but then also like the birth stories are so helpful to like hear a wide range of like what could happen, and
Right.
just like
Right.
that, again, that you just never know.
Right.
But
Right.
that also listened to evidence-based birth,
Uh-huh. Yep.
birth naturally.
Oh, I haven't heard of that one.
I think that's the one with two sisters, and they talk
Okay.
about like they have birth stories, but then they
Sure.
talk about like their births
Okay.
and
I'll
stuff.
have to look that one up. Okay.
And then, what was, I mean, I listened to a bunch. I can't even remember all of
The
them,
birth
but,
hour, maybe.
maybe there was another one with a doula that I listened to. The birth story. Oh, I don't know.
No, that's okay.
It was
I just
a
like to share
doula.
people.
Yeah.
Yeah, yeah. Some if people are like me, like I'm a podcast junkie, so
Yeah.
it's like if I hear one, I want to hear all of them. So I like to share other options for folks besides mine. So yeah, so that's cool. And then so you definitely knew you wanted an unmedicated birth. You listened to podcasts. What else did you do to prepare?
Oh, to prepare, more of like, what did I not do?
Oh, okay. Let's
I
go
did
ahead and get into
all of
it.
it. So I actually, starting even before we were trying to conceive, I was
Okay.
listening to podcasts. I was reading
Okay.
books.
Okay.
I
Okay.
changed my diet
Okay.
because, I'm a dietitian. So
Right.
I had been a vegetarian slash pescatarian for like 20 years.
Okay.
And like a year before we were going to start trying, I started eating meat again because I knew that
Really?
was going to be really important. Yeah. For conception.
What?
And then,
That's interesting. What made you come? I mean, like all of it, like red meat, pork, all of it, or just what'd you
yeah,
do?
I dipped my toes in here and there,
Right.
like as I was kind of getting back into it. But yeah,
Uh-huh.
now like I eat all of it. But just because really, I mean, you can,
Uh-huh.
being a vegetarian or pescatarian, it's just going to be
Uh-huh.
a lot more. You're going to have to be really, really intentional about making sure that you're getting all your nutrients that you need. Making sure you're taking your vitamins, the things that you do need to supplement.
Right. Right.
So I started eating meat again, and
Right. Right.
now
Do you feel like it affected your body at all?
there was one time that I was definitely like a little GI upset,
Okay.
but honestly, no. Otherwise, like, because like I said, I just kind of took it slow,
Gotcha.
as I was starting to eat meat again, and no, I felt good.
Right, right, right. Okay, that's interesting. I can't say that I've ever heard anybody do that. That's an interesting perspective. And obviously you know the information because you're a dietitian. So and you felt good and feel good about the decision.
Yeah,
Yeah.
absolutely.
Yeah.
So
Yeah. Okay.
yeah. So then, yeah, and I started cutting back on caffeine because I'm a coffee lover. So I was like, all right, I got to cut back on that. But then
Right.
once we got pregnant, continued to read like more books, listen to podcasts, continued exercising. I was already doing that, but probably did more like yoga and stretching than
Okay.
I was doing previously.
Right.
Did meditation.
Uh-huh.
I, and okay, let's see. I did some massages,
Okay.
definitely. If you
Okay.
can do
Nice.
that, that
Nice.
is
Yes.
a
Yes.
nice little
Yes.
treat.
Yes.
But helps your muscles like relax, you'll be
Uh-huh.
able to stretch,
Right. Right.
and get baby in the right position.
Uh-huh.
Went to chiropractic care in third
Okay.
trimester.
Okay. Did you find that helpful?
So I did it alongside what I was getting ready to say, pelvic floor PT. So definitely for sure that was helpful.
Okay.
Chiropractic, I don't
It
know.
was
I
like,
couldn't
right.
necessarily tell you yes or
Sure.
no.
Sure. Sure.
Um, but the pelvic floor PT was absolutely helpful.
Okay.
I would
Okay.
say, I would recommend that to anyone.
Gotcha.
And
Did your
I
insurance cover this, or did you have to pay out of pocket?
I paid out of pocket, but
Mm-hmm.
I had already like known a PT around the area. And
Uh-huh.
so I would just like went to her.
Gotcha.
Um, so I didn't check beforehand, which I probably should have, and they didn't. I tried to like
Uh,
submit the claims afterwards, but
sure. Okay.
but there
Yeah.
are multiple around the area. So maybe if I would have
Uh-huh.
checked with somebody else, it would
Okay.
have been covered.
Gotcha. Gotcha.
So, and I didn't go until I was like starting to have like pelvic pain and
Uh-huh.
like low back pain and like
Uh-huh.
even like a little bit of urinary issues.
Okay.
And realistically, I probably should have gone sooner.
Okay.
Just kind of like more preventative. But
Mm-hmm.
so I went to them through third trimester and then also checked it back in postpartum.
Okay. Okay.
Yeah.
And then did you do any specific how were you planning to manage pain if it wasn't going to be with medication?
Yes. So, breathing
Uh-huh.
was like going to be a huge thing I knew. And I was,
Mm-hmm.
trying to do meditation. So, kind of help with that. But I mean, I was mostly focusing on breathing. I
Uh-huh.
did get a doula.
Okay.
So I hadn't got there yet. So I'd hired a doula. So was going to hope, I was hoping that would help.
Sure.
Like she could do some maneuvers and,
Yes. Yes.
but yeah, I mean, I was just going to be focusing on breathing and, water, not water birth, but like,
Right. Right.
I was
Using
hoping that I could
water to help.
be
Right.
in the tub here at home,
Uh-huh.
which didn't end up happening. But yeah, I was just
Yeah. 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 Did you
breathing
take
and
any Yeah, sure. Yeah, no, that makes total sense. Did you take any childbirth education classes at all?
so not specifically childbirth education.
Uh-huh.
Like I did so much research on my own, like reading books
Yeah.
and
Yeah.
podcasts that I felt
Yeah.
like knowledge wise for that, I was prepared.
Gotcha.
There's a center here, like the Newborn Center of Charleston. They have like a breastfeeding class and an infant care class. So I took those.
Uh-huh.
And then, my doula would come, she did a couple prenatal visits. So she'd
Okay.
come over, she had some like books
Gotcha.
but any like things I feel like I already knew
Gotcha.
because I'd
Gotcha.
already done
Gotcha.
so much
Yeah.
research on my own.
And I was just gonna ask about your doula and whether or not, like, at what point did you hire her, and like, what was the relationship, or how were things during the prenatal period? Like,
Yeah.
what did she do
So
to help? Mhm.
I kind of knew pretty early that I wanted a doula, because I wanted unmedicated. And I just felt like
Right.
having another, first of all, having a woman there to help me who's, knows births, has been through
Right.
births. But, and then obviously like all the things that they can help with. But I think I hired her maybe second trimester, and she would do a couple prenatal visits, just kind of like check in, see if I needed any information, kind of talk about things,
Right.
The plan, and then like how things were going to go. And the one that I hired wasn't actually the one that was there because,
Okay.
which I knew there was a chance. She was leaving for vacation the day before my due date. And so I knew it was a chance, but I was like, okay, my mom went early on 2 out of 3 of her births. Maybe
Right.
I'll go early. It'll
Right.
be
Right.
okay. But so it
Didn't
wasn't
quite happen
her,
that
but
way. Right.
it was, I still had a doula there.
Okay. Okay. All right. And then you wanted an unmedicated birth. You were all in for that. Are there any other things that you wanted for your birth?
I mean, like the aftercare, I wanted skin to skin right away, like all the kind of, I wanted baby to be on my chest to try and, really enjoy that like golden hour.
Right.
But I mean, for the birth itself, I just didn't want like a lot going on. Like I didn't want a lot of in and out, like a lot of checks. While I was at the hospital, I did like want dim lights if possible. The hospital that I was going to had like showers and baths.
Okay.
So I had requested that one, I think all of them did, but I was like, I had that on my birth plan that I wanted one with at least a shower or a bath.
Gotcha. Gotcha.
So, and like no coached pushing. I didn't want that.
Right. And you
I
said you
wanted
had
to
a
be
birth
able to, Oh,
No, go ahead.
I was going to say, I wanted to be able to try pushing in any position if I wanted, because that
Yep.
was one thing I really did not know. Like, what position am I going to want to push in? I
Right.
don't know until I'm going to be there. Right. So,
Yep. Absolutely.
so that was one thing.
Okay. Okay. Good. Good. So, and you said you had a birth plan. Did you talk about your birth plan with your doctors during your prenatal visit, or did you bring it to the hospital?
I did. I talked to my primary, the
Uh huh.
doctor that I've been
Uh
seeing,
huh.
and because she actually had, because from the very beginning I told her like, hey, I do want to do an unmedicated birth. Like, how do you
Right.
think that's going to go? Like in this
Right.
hospital, and
Right.
she was like, oh yeah, she's like, you could do it if that's like what you're going to set your mind to.
Right.
Go for it and you can do it. She's like, but she was like the caveat, but be prepared to be flexible. So, and I was like, okay, yeah, sure. And then at one point she had asked if I'd had like kind of a birth plan.
Uh huh.
And she's like, all right, well, bring it to your next visit and we'll go over it. So,
Okay.
so we did, which was really helpful because there was some things, because I was like, well, I don't want Pitocin. I don't want, any of these medications ideally. And,
Right.
but she like was like, okay, sometimes we use medication if, you're not progressing. We don't necessarily have to go full throttle and like it be
Right.
on the whole time, and she just kind of explained like, okay, these are some interventions that sometimes we use and this is why we use them. Not
Yes.
necessarily like it's all black or white. So it was helpful to talk to her about it. And she was
Yeah.
like very, I mean, obviously she was open to me doing unmedicated, but she just
Sure.
wanted me to like understand why things happen.
Yeah. 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 That's really important because that's not a conversation that you want to have in the middle of labor while you're trying to deal with contractions. So you had a better idea going into it what to expect.
Right.
Yeah, for sure. All right. So let's get into what was your labor and birth like?
Okay. So I'm going to actually start with 39 weeks
Okay.
because that kind of plays into my delivery. So at 39 weeks, I got a phone call and my primary OB wasn't going to be able to do my check that day. They were
Okay.
like, hey, you can reschedule it for later in the week or you can go in with this other doctor. And I was like,
Right.
I need to set it for the same time. I just need to
Right.
come in.
Right.
So I went in, and my check I was 1 centimeter dilated,
Uh huh.
80 or 90% effaced,
Okay.
and I think -1 station.
Okay.
And it was pretty much the same as the week before. But when she did my check, I was like, oh my, that hurt like way more than last week.
Right.
It's like, and then she did my fundal height and she was like, your fundal height's off. We need to go do an ultrasound now. Your fluid might be low and we might need to induce like today.
Right.
And like that. And I was like, whoa,
Deeper. Okay.
okay.
Right.
All right, we're going to get an ultrasound. Thankfully, I mean, my fluid was fine. It was like on
Right.
the low side of normal.
Right.
And then afterwards, the OB was like, okay, well, your fluid was okay, but we're getting you another ultrasound and a stress test for next Monday, like your 40 week. And we need to get your induction scheduled now. Like it needs to be for like, it was going to be like 40 in a couple days.
Right.
And I was like, whoa.
Right.
And she's like, but I kind of stripped your membrane, so we might not make it there. And I was like, whoa. First of all, what do you mean kind of? I don't really
Right.
know what that means.
Yeah, like either you did or you didn't. Like what is
Right.
right?
But I was just like in shock because I was like, well,
We
I didn't consent to that.
right.
I didn't
Right.
talk about that. And it was just like the discussion was just so like blunt and abrasive to how I was used to like my OB, like, cause my
Right.
fundal height had been off like a month prior and my OB was
Sure.
like, oh, it's probably just the way your uterus is sitting, but we just
Right.
need to get a ultrasound check to make sure. And,
Right.
this is just extra precaution, like
Right.
totally two different demeanors.
Right.
So I was like, left that. And I was just like, okay, well, all right. And I was like, well, if you're going to kind of strip them, I wish you would have just stripped them.
Right. I mean,
But anyway, so 39 weeks comes and goes. It's, I'm 40 weeks. It's a Monday. I go to my appointment with my primary
right.
OB and my check was, and I had asked her, I was like, I want you to strip my membranes today
Right. Okay.
because I don't want to be induced. And, my check was she's like, well, you're 1.5 centimeters. She's like, I can't really put that in, so I'll say 2, but
Right.
she's like, you're 90% effaced and -1 station. So I was essentially the same. And I was like, defeat. Like, I just was like distraught. I was like, I don't want to be induced. I started crying in the office. I was like, I don't want to be
Oh,
induced. I just want to go into labor naturally. Like, I
right.
don't want the, and
Right.
she was like,
Right.
she was so sweet. And she's like, tell me why you don't want to be induced. Are you scared? Like, what's going on? And
Right.
I was terrified of a C-section.
Okay.
Like, I knew, like, okay, if that had to happen to keep me and baby safe, like, it
Right.
had to happen, but literally,
Right.
like, terrified me.
Okay. Okay.
I know some people are totally okay with it, but I was
Sure.
just like, think about it, and I'm like,
It
whew.
would just right. Right.
Yeah. So I'm telling her all this, and she's like, okay, well, like, I had asked her to, so she had stripped my membranes, and she's like, she talked about the options. She was like, how about we have you come in on Thursday? They had my induction scheduled for Friday. I'll strip your membranes again. We'll check and see where you're at. Like, you won't need Cervidil because you're already effaced. Like, maybe we'll just use a little bit of Pitocin to get things started. Or maybe there was another medication that she said that she was like, maybe we could just use that instead of Pitocin, but I don't remember.
Cytotec maybe or
I don't think it was Cytotec. I don't know. Anyway,
okay. Yeah.
and so she was like, reassuring. She's like, but again, you might not even make it there. Like, you
Right.
might go into labor tonight
Right.
or tomorrow,
Right.
or,
Right.
and so I'm like, okay. So I call my husband. I tell him what's up. He's already off work because I'm 40 weeks. That's my due date. And he's like, okay, why don't you come home? It was our younger dog, Orzo's birthday that day. And so he's like, we'll go out to eat and we'll get some French dips. We'll bring Orzo along. And so I'm like, all right. So I go home. And by the time I got home, he's like, why don't we take a nap? We should rest first. And I'm like, okay. So by the time we wake up from our nap, I'm like, okay, traffic's going to be terrible. We're not going to the brewery we wanted to go to get these French dips. I'm like, it's the last time I can go to prenatal yoga. I was like, I'm going to go tonight. And then when we come back, we'll go get our French dips. On my way to yoga, my water broke.
Okay.
Like, at first it was like, did my water just break? And then like 20 seconds later, I was like, oh yeah, it was a gush.
Fluid
it was
coming all out of my body, and I have no control over it.
Yes. It was, my water broke. So I called up the studio. I was like, hey, my water just broke. I'm actually not coming. I turn around, I go home, and my husband's like, what, did you decide not to go to yoga? Are you ready to go eat? And I was like, no, my water just broke. I was like, he's like, are you sure? And I was like, yes, I'm positive. So he's like, okay, we gotta go to the hospital. I'm like, no.
Right.
We got to take care of the dogs. I got to get something to eat. I haven't eaten. I got to shower. We got to finish getting our bags. Like, no. So he's like, well, have you called the OB? And I was like, no. I was like, okay, I'll call him. And so I called triage, and they're like, oh, the OB will call you back. And I was like, okay, who's on call? It was the doctor I had at 39-week check. And I was like, I hung up. I started crying for like 20 seconds. And I was like, okay, Kristine, get it together. You got a baby to deliver, so you don't have time for this.
Okay. You're like, let me gather myself here because.
Yes. So I'm like, and by the time, like 7 a.m., it's going to be shift change. I'm not going to have this baby forever. I'm like, I'm first time mom. Like, it's going to be a while.
Right.
So I call her, she calls me back, and she's like, oh, are you having any contractions? I'm like, no, I don't think so. Just some Braxton Hicks. Cause I've been having those since like 30 weeks. And my husband's like, Kristine, your water broke. Those are contractions now. I'm like, oh, okay. I guess so. And so she's like, okay, we'll just monitor things for a couple hours and call me back. And I'm like, okay, I like that answer because my husband's trying to get us to leave and go to the hospital. I'm like, no. And so I do some like sidestep stairs. I'm bouncing on the ball. Every time I have a contraction, which they're so mild at this point. My dogs are like barking, and they're like, my old boy Charlie's like sitting at my feet, and the other dog is like going crazy. But I'm like, they're just so intuitive. I'm like, I'm not even like breathing through this. How do you know I'm having a contraction?
And they know something's going on.
Crazy. But then they kind of start to like pick up the contractions but they're so erratic. Like, I'm having one every 7 minutes, and then it's every 2 minutes, and then it's 4 minutes, and then it's back to like 45 seconds.
Right.
They're like all over the place.
Right.
So I'm like,
Oh, did you call
okay.
your doula at all?
Oh, I had been texting her and like
Gotcha.
telling her what's up.
Gotcha.
And she's like, okay, keep me updated.
Right.
Or, well, she was the one that was like, start timing them.
Okay.
Cause I was like, they're kind of, and she's like, okay, let's go ahead and start timing them. So I timed them and I was like sending them to her. And then so finally my husband's like, we've got to get going. Like they're all over the place, and I'm like, well, okay, I'll shower. Like, and then we call up the OB and she's like, all right, well, your water's already broken. So just come over. And this was, we started heading over, I think around like 7:30. So
Okay.
we had to go through the ER, but she was like, you're not going to have to go into the ER
Right.
because, your water's already broken. We're going to admit you.
Yeah.
So I was like, okay. So then by the time we get to the hospital, they're picking up. They're like every 3 to 4 minutes consistently at this point. And like,
Okay.
I'm having to breathe through them.
Right.
So I get get into the hospital. The
Uh-huh.
first thing the nurse asks, do you have a birth plan?
Right.
And I
Oh.
was like, yes, thank you. I do. And my
Oh.
husband got it. And my nurse was amazing.
Mm.
She was so good.
Right.
She checked me and I was 3 centimeters.
Okay.
And so but I kind of knew like, I'm not going to be super far along. Like my
Right.
water just broke. I just got
Right.
checked earlier today. Like,
Right. Right. Right.
but
You
they
were probably
admit
like, I
me.
just don't want to be one. Like you.
Right. Like some progress.
Yes.
So yeah, we kind of get settled in. My husband, let the doula know, hey, my wife wants you to go ahead and come down. So that was like 8:30 or something PM.
Uh-huh.
And so they've definitely picked up in pain and I'm in the well, they did monitor, I guess, at first. And then I'm in the shower. I use that for my pain management, like pretty much the whole time. I was in the
Right.
shower almost, unless I was getting the monitoring,
Uh-huh.
I was pretty much in the shower with
Okay.
hot water on my back. I had bad back labor.
Okay.
So that really helped with the
Okay.
water.
And they were taking you off of the monitor for you to go in the shower.
Yeah, so actually
Okay.
that was one thing that I had requested was like the
Uh-huh.
intermittent
Yeah.
monitoring.
Mm-hmm. Good. Good.
So yeah, my husband thought it was so funny. I I had they give you the gown and I have the gown on and they have the thing around my belly, they're doing the contractions and I was like, I had the head of the bed up and I was like kind of like facing it, like leaning against it
Uh-huh.
because that was just what I didn't want to be like on my back. Like that was terrible.
Right.
And I was like so distracted by the gown. And I was like, can I just take this off? I was like, I'm in the shower. I'm like, and she's like, girl, you don't have to wear anything if you don't want.
Yeah.
I'm like,
Like,
whip it off.
yes.
And my husband thought that was like so hilarious that I was just like walking around for hours. And I'm like, I'm having a baby. Like,
Yes.
what's it matter?
Yes. Yes. Absolutely. Yes.
So,
Love it.
so yeah, I would just, I don't know how often they were doing the
Mm-hmm.
monitoring, but yeah, whatever the typical is, I think.
Uh-huh. Yeah.
And then so at around 8:30, I was 3 centimeters, and then they checked me at 11:30,
Uh-huh.
and the doctor had come in. This was the doctor
Okay.
that did the check now, and I was 5 centimeters.
Okay.
But I was like kind of bummed about that because I was like, whew. I was like, I'm struggling. Like this is hard.
Right.
I was like, I'm having to breathe through it. Like this is
Right.
bad back pain.
Right. Right.
I was like, I'm using the shower, and I was like, I don't know, can I do this? And I
Right.
mean, my doula and the nurse were like, you're doing great. Like you
Right.
can't, you're already doing it. They're like, don't
Right.
look at it as if you're only halfway.
Right.
They're like, you're already at that point. I think I was maybe 100% effaced or something.
Okay. Right.
And maybe, I guess I was, it must have been that check that I was at 0 station.
Okay.
So I was like, things besides dilation were happening.
Uh-huh.
And they're like, you're doing great. Just keep going.
Right.
And my doula was
Right.
like, take it one contraction at a time. Like you got to
Yep.
release your shoulders. You got to release
Yep.
some of that tension.
Right.
I'm like, all right. And I just got in the zone. Like
Okay.
I was just from then on, I just feel like, I mean, it was hard, but I was like, I was just so like focused.
Right.
And shortly after that check, I had told my doula, I was like, I'm feeling like a lot of pressure.
Mm-hmm.
And she was like, and I was like, this, like, I'm feeling different.
Right.
And she's like, I was like, should I get checked again? And she's like,
Right.
I mean, we can ask if you want to get checked, but like,
Right.
it's only been an hour. and you were 5 centimeters and you were a little discouraged at 5 centimeters. So I don't want you to get more discouraged.
Right.
And I'm like, okay, yeah, you're right. You're right. Okay. So I just was like breathing through it. I'm like visualizing like flowers blooming. My cervix is opening. Like baby's going to come soon.
Right.
My, the doula and my husband were taking turns doing like hip squeezes and back counter pressure. And intermittently I'm having to go get the checks, or not the cervical checks, the monitoring.
Yeah, right.
And then at one point the nurse comes in and she's like, the doctor's going to come in a few minutes because we need to check you. Like your contractions are on top of each other. And I was like, oh, okay. All right. That's fine. And from the time it took me to get from the bathroom to the bed, I had like 3 contractions. It seemed like it took me forever to get there. Because I'm like dying in the middle,
Right.
But no, I mean, I was okay. But, and so then the doctor checks me and she's like, if you want, you're ready to push. Okay. And I was like, and this was at 1:30. So from 11:30 PM to 1:30 AM, I went from 5 to 10.
See.
So it went part and
just, yes.
It went quickly. I mean, it didn't, but like all in all, it went quickly. And, some people, or when I heard unmedicated stories talk about like the transition period, they're like, oh, it's like your demeanor changes, like, and it's kind of like an out of body experience and like, you're not with it. And I felt the opposite. I was like so focused. I was like so in tune with my body at that point. Like I remember my husband trying to distract me. Like he's like, hey, look at our dogs. Like, because we had our camera on our dogs so we could watch them. Look at Orzo. He's so nervous. He's looking out the window for us. And I'm like, I'm focusing. Don't.
Right.
If you're not going to squeeze my back, I don't want to hear anything. But yeah, so I went from 5 to 10 in like 2 hours. And so then she was like, yeah, if you're ready to push, like you can push whenever you want. And so I tried a few different positions. I did like side lying. I did kind of like the same position I was doing while I was getting the checks, where I was like facing the inclined head of the bed, if that makes sense. Like kind of like, and then
it might be hard for people to know. I know exactly what she's talking about because I can see the labor bed, like I can see it in my head in the labor room. But you were just kind of like facing the head of the bed, and like you can sit the bed up and sort of lean over it.
Exactly. Yeah. So tried that, and then tried side lying, like the opposite side lying again, and I felt like this baby's got to be progressing out. Like we didn't know if it was a girl or boy. So I was like, the baby's got to be coming. I was like, and I kept asking, I was like, is the baby crowning? And they're like, no. And I'm like, oh, I have a few choice words, every time. And then the doctor, the OB, is like, okay, Kristine, like if you want me to check like how you're doing while you're pushing, I need you to get on your back so I can like see what's going on. And I'm like, I don't want to get on my back. And she's like, if you want me to help you've got to do that. And she's like, otherwise you can keep pushing how you want. Like, it's up to you. And my husband's like, Kristine, just do what she says. And I'm like, okay, we'll do that. And she's like, we'll get she offered a like hot heating pad to put underneath my low back. And I was like, okay, let's do that. So then we did that. And she's like, okay. She's like, she told me she thought it would be best if I continued to push on my back, like where she could see kind of like how things were going. So I was like, all right. So, I pushed and then eventually baby's head started coming out, and they were like, push, like keep pushing. Like at that point they were like, you need to like get this baby out, because I didn't know at the time, but the cord was wrapped around the neck, and, which was, she got it out, unwound like super quick. But my husband was like, I think like baby was kind of like desatting a little bit at the very end. And that's why they were like, at this point you got to like just keep pushing. So I didn't really get a break between the head and the shoulders. But baby came out and she was like, look down at your baby. It was only 45 minutes. So not too bad. Yeah. So, I mean, I don't know. It's labor was such like a time warp. Like it seemed like a long time, but at the same time, it didn't seem like any time at all. I don't know. It's probably hard to explain if you haven't been through it, but I'm
Yeah,
sure all
yeah.
those people that have know what I'm talking about.
Exactly, exactly. So baby comes out.
Yeah, and she's like, look down, like, and she holds, and I saw that it was a girl,
Right.
which I thought it was a girl, but we didn't know. So,
Yeah, yeah.
so I was like, okay, we were all excited, and my husband saw in, and yeah, and they got baby like right on my chest,
Okay.
did the delayed cord clamping,
Uh-huh.
and yeah, baby was like healthy and all was
Awesome.
good.
Awesome. Awesome. I love it, love it, love it. So, it's sounds like that doctor ended up being okay then in the end, or was it that you just didn't have that much time with her, or or a combination of both?
No, she's a good doctor. It was
Okay.
just that, like my husband said, because he liked her. He was like, no,
Uh-huh.
she was like straight. She's to the point. She got out a
Uh-huh.
healthy baby, which was, that's what her job is. And I was like, no,
Right.
absolutely. It was just, he's like, you want somebody warm and fuzzy that's going to like
Yeah.
give you a hug. And
Yeah.
that was just not her personality. So no,
Gotcha.
she was a good doctor. I didn't have like the best 39-week experience,
Gotcha.
with her, but
Gotcha.
like, she got the baby out and baby was healthy and
Okay.
all was
Okay.
well.
Okay. I
So
mean, well, you got the baby out because you did the work. So she just made sure nothing crazy happened. But
yeah,
you got the work. You got the baby out. So
yeah, yes.
so then, did you have to get any stitches or anything?
No, I did not tear.
Look
So
at
no
you.
tearing. Yep. And when I went to pelvic floor PT,
Uh huh.
we not only worked on like back pain and all that, but we did like pushing prep, and we did the
Ah.
perennial massages. I had started
Uh
that at
huh.
like I think 34 weeks.
Uh huh.
So and then we talked through like using your breath while
Right.
pushing, not bearing
Right.
down, like
Right.
that sort
Right.
of thing. So yeah,
Right.
thankfully no tearing. And so yeah, definitely made recovery,
Okay.
pretty good.
Nice, nice. And then I forgot to ask, do you feel like as you were pushing, like during the crowning, do you remember like ring of fire or increase in intensity or anything like that?
Um, I mean, increase in intensity, yeah, for
Uh-huh.
sure.
Uh-huh.
But not the ring of fire. I don't,
Okay.
you know what, actually. So, the doctor at one point, she was like, asked if she could inject lidocaine into my vagina.
Okay.
And so I guess technically not completely unmedicated, but
Okay.
and I was like, oh, I don't know about that. I was like, and my husband was like, she's worried about you tearing really badly, and she's going
Right.
to have to put lidocaine in there for you to stitch up anyway. So
Right.
he was like, just, it's fine. Like the lidocaine, the local lidocaine is fine.
Interesting.
And I was like,
Right.
okay, that's fine. So maybe that's why I didn't feel the ring of fire,
Okay.
but definitely like an increase in intensity.
Sure.
Oh, for
Sure.
sure.
Sure. That's interesting that she asked to do lidocaine even beforehand. I have never done that before.
I remember her explaining some things, but I don't remember what she was
Sure. Yeah. I mean,
explaining.
yeah, you were in your zone, like you were focused in the moment. Okay. Okay. Interesting. All right. So everything went well afterwards. How long did you stay in the hospital? How was your postpartum course?
So I delivered at 2:29 a.m. So we had to stay like a little bit longer than 24 hours. So
Right.
we like, I don't know, like 36 or whatever. So
Right.
really one full night.
Okay.
But yeah, I mean, my recovery was really good. Like I said, I didn't tear. So
Uh-huh.
I walked to the postpartum,
Okay.
unit,
Right.
and like was walking around the unit. Like I said, my labor nurse was amazing. She like even she like got off shift the next night. She like came and checked on me.
Oh.
Like she was so sweet.
Yes.
But
Yes.
anyway, but yeah, like latching was tricky as far as
Okay.
breastfeeding.
I was
Like
gonna ask about breastfeeding.
yeah, so it was definitely tricky. Like the nurses and the lactation consultants had to come like help me. I feel like the first, or while I was in the hospital, I don't know that I got her to latch on my own. And my husband was so worried. He's like, I don't think we can take her home. Like she's not going to be able to eat anything. Like, but we like figured it out kind
Right.
of. Like it was
Yes.
definitely a struggle. And that was one thing. I should have booked a outpatient lactation consultant sooner. Like
Okay.
I ended because my breasts and nipples were so sore,
Okay.
postpartum. And so, when she's nursing, I was just thinking, okay, well, my body's just like getting used to things. This is
Right.
different. Like,
Right.
I just need to like kind of toughen up. Like, it'll eventually get better. And so at one point, it's in the middle of the night and I'm nursing and my nipple starts bleeding. I'm like, okay, well, that's not
This is,
normal.
yeah.
So, okay.
Yeah.
So at that moment, I literally booked a lactation
Okay.
consultant appointment
Okay.
and they were
Okay.
so helpful. So I would say the first month of breastfeeding was the hardest. But like the lactation consultants were super helpful. That helped like the tips and the tricks. And yeah, and now I'm still breastfeeding and she's 15
Okay.
months. So
Nice.
yeah.
Nice. Love it. Love it. Love it. So, looking back, is there anything like one thing in particular or a couple things in particular that you found were really helpful for you, or was it just like the combination of the things, the combination of having the doula and the pelvic PT ahead of time and like educating yourself? Was it all just all kind of came together? What do you think?
Yeah, I think it was the combination of everything for sure. My husband was like, "You're over preparing," and I'm like, "No, I'm not." Like, and
Right.
going into labor, like I was ready. I was excited. I
Uh-huh.
was ready. But yeah, I definitely think it was a combination, like knowing, that I need to be, breathing, doing all like the low moaning, the horse lips, like all the things.
Right. Right.
But I would say if you're looking into like one thing, I would
Uh-huh.
recommend pelvic floor PT for sure.
Okay. Okay. All right. All right. All right. Yeah,
So,
we don't utilize that enough at all. At all. So I guess I think I know the answer to this question, but how do you feel about your birth experience?
oh, so good. Yeah, it was
Yeah.
super positive. It was
Yeah.
such a good experience. I sometimes when you listen, I was listening to some of the unmedicated, either podcasts or books, and I did feel like there's a little bit of a negative connotation on hospital births. Like the unmedicated birthing world kind of, poos on the
Yeah.
hospital
Yeah.
and they're like, oh, once you get there, you're going to stop progressing. The lights are so bright and like,
Right.
everyone's going to want to check you. There's just a lot of like negatives, but
Right.
I felt very comfortable and good about being in the hospital. Like obviously I had like an amazing nurse.
Sure.
She did dim the lights. Like I was able to do the intermittent monitoring.
Right.
I didn't have to be hooked up to an IV. I was able to use the shower. Obviously I had the
Right.
doula. So
Right.
I had a good hospital unmedicated birth
Yeah.
experience, which I was a little bit nervous beforehand, just because you hear kind of some
Yeah.
negative things.
Sure.
So I
Absolutely.
would say if, somebody's wanting to do that, it's totally possible.
Yeah. Yeah. For sure. You just have to do like you did and prepare.
Absolutely.
Yeah. So maybe you answered this already, but just to wrap it up, what is the one like your favorite piece of advice that you would give to somebody who's getting ready to have a baby now?
I would say don't wait until there's something wrong to get support. Like for me, for pelvic floor PT or lactation consultant, like it's okay to seek out health providers or support, even if there's not an issue.
Yes.
Like realistically, you should be doing that
Yes.
beforehand, right?
Yeah.
So,
Yeah.
so
Yeah.
don't wait until there's a problem. Like do something for, this is for you. This is for your children. Like do it ahead of time.
Yeah. Yeah. Love that. Love that. So where can people find you? I don't know if you do virtual for any of your dietitian things that you do on
I
the side, but
do.
yeah. So where can people connect with you?
Yeah, I actually only do virtual as far
Oh,
as
okay.
nutrition
All right.
counseling. Yeah.
Yeah.
So my business Instagram is KristineLegree.rd.
Okay.
Or just my website is www.kristinelegree.com. So
Okay, awesome. Perfect. Well,
yeah.
thank you so much for coming on to share your story. I think it's really important to share positive experiences of hospital birth. And so I appreciate you coming on today.
Oh, absolutely. Well, thank you for sharing everybody's stories and for all the education that you provide.
Oh,
Super
thank you.
helpful.
Thank you. Thank you.